blogger called Dr. Moran, who is otherwise an advocate of science-based medicine, has made a video claiming that the Moderna vaccination against COVID-19 causes myocarditis in around 3% of vaccinated adolescents. That's a rate that's, according to him, 20 to 50 times higher than the rate COVID-19 itself causes myocarditis. Since, as far as I can tell, nobody else has made a video or a blog post responding to that claim, I have decided to. I mean, I can see how people think it doesn't even deserve a response, like Flat Earthers' videos don't, but I think it is important that there is some sane opposition on YouTube. Flat Earthism wouldn't spread as much if there were people responding to their arguments.
What is the risk of death from vaccine-induced myocarditis? A new study just came out from England looking at 1956 deaths in vaccination records in the 12 to 29-year-old age group. In the video, I'm going to talk about health outcomes after myocarditis diagnosis and subclinical myocarditis, which is when people have evidence of myocarditis with or without symptoms but don't come to healthcare providers like myself. I've talked a lot about myocarditis with respect to the COVID-19 vaccines over the last 2 years, the mRNA vaccines. It's of course been a subject that those have spoken about it, even doctors have been labeled anti-vax.
So, are you an anti-vaxxer? Well, if it is anti-vax to claim that MMR vaccines cause autism and that therefore almost everything we know about how brain works is wrong, then I don't see why claiming that the Moderna vaccine causes myocarditis at a rate far higher than COVID-19 does wouldn't be anti-vax. If anything, it is even more anti-vax in the sense that it is less scientifically plausible. What you are essentially claiming is that inserting a piece of virus RNA into a cell produces some toxins which don't exist in the virus itself, right? Well, that would require much about what we know about cell biology to be wrong. And cell biology is a harder science than neuroscience is. You claim to be an advocate of science-based medicine, yet what you are talking here is going very much against science-based medicine. If you want to be taken seriously, at least provide a speculative explanation for how what you are saying might be the case. To be clear, if you claimed that the Johnson & Johnson vaccine causes myocarditis more often than COVID-19 does, I would consider that plausible. Johnson & Johnson is a genetically modified monkey virus, which is guessed to be harmless to humans, but it indeed does contain plenty of proteins, each of which might be toxic to humans, which don't exist in the COVID-19 virus. What makes your claim extremely implausible is that you are claiming that about Moderna and Pfizer. Talking about vaccine side effects is not being an anti-vaxxer, but claiming that vaccines somehow magically cause all kinds of diseases is being an anti-vaxxer, the keyword being magically. And since in this video you are also massively deflating the danger of the disease the vaccines protect against, that adds to you being an anti-vaxxer.
The issue here, though, is that this is a definite side effect to the vaccines, and it's something for people to consider when contemplating vaccination or boosting. One always needs to consider the benefits of what you're doing against the risks, and we do that for all interventions in medicine. Now,
the basic principle of science-based medicine is that those advantages and disadvantages need to be scientifically plausible to be taken into account. We don't need to know the precise mechanism of action, but the disadvantage of the Moderna vaccine, that putting a piece of RNA of some virus inside a cell produces some toxins which don't exist in the virus itself, and which cause myocarditis more often than the virus itself, is not scientifically plausible. Sure, it's not as implausible as homeopathy is, but it is still implausible. Of course, scientific plausibility is not the only thing that matters in science-based medicine. Once you have scientific plausibility, you need to have evidence. But you don't even have the scientific plausibility here.
Now, despite all of this, you still see people, physicians included, in fact, claiming that myocarditis is more common from COVID-19 than it is from vaccination. And that's clearly in the young male age group below 40, not true.
But that has to be true if you assume the basics of molecular biology are true. Once again, the only way it wouldn't be true is if inserting pieces of virus RNA into the cells produces some toxins which don't exist in the virus itself, which would require basics of molecular biology to be false. The whole point of RNA vaccines is to make such things that a vaccine causes some side effect more often than the virus itself does theoretically impossible.
It's far more common after vaccination in that age group than with infection, and numerous studies have suggested that this is on the order of 20 to 50 times greater. As a physician who manages myocarditis myself, insisting that myocarditis is mild is not really appropriate. We certainly do have some evidence to suggest that post-vaccine myocarditis on average is less severe than classic myocarditis.
Well, obviously, you cannot claim both that Moderna vaccination causes myocarditis in 3% of vaccinated adolescents and that myocarditis causes death in 27% of the cases like regular myocarditis does. If that were true, people vaccinated with Moderna would be falling like flies. 1% of the adolescents vaccinated with Moderna obviously do not die from myocarditis. Pick one of those claims, as you clearly cannot claim both.
But if you take a look at the average, which is 70%, that actually would correspond to an absolute risk of about 1 in 300,000 risk of cardiac death after having your second dose of the mRNA vaccination, if you're a male in that age group. And that's about the same risk as death from COVID in an unvaccinated, never previously infected male in this age group.
The chance of a non-vaccinated adolescent dying from COVID if he catches it is low, but it is not 1 in 300,000. There are thousands of deaths from COVID in the 20 to 30 age group in the US. If the chance of an adolescent dying from COVID-19 were 1 in 300,000, there would have to be hundreds of millions of infected adolescents, and there aren't so many adolescents in the US. To claim that the chances of a non-vaccinating 20 to 30-year-old dying from COVID is 1 in 300,000, you need to claim that the number of 20 to 30-year-olds dying from COVID has been overestimated by an order of magnitude, which is implausible. If you want to claim that the number of 70-plus-year-olds who died from COVID has been overestimated by some 50 or so percent, claim that. I also think that. It is indeed hard to tell what a 70-year-old died from. But don't claim that the number of 20 to 30-year-olds who died from COVID has been massively overestimated. It is easy to tell what a 20-year-old died from. The chances of an unvaccinated 25-year-old dying from COVID-19 if he catches it is around 1 in 2,000. And since I am slightly overweight and I am regularly taking alprazolam, my chances of dying if I get COVID are probably even greater than that.
If the incidence of myocarditis is somewhere in the 1 to 1,300 to 1 in 7,000 range in the population I'm talking about, well, what's the incidence of subclinical myocarditis? Now, there have only been a couple of studies. They're small, one from Thailand and one from Switzerland. I've talked about the one from Thailand on the channel before. And in that study, there were 301 students in the 13 to 18-year-old range, and they were followed both before vaccination as well as after. with cardiac tests, and they found a 3.5% incidence of subclinical myocarditis after the second dose of Pfizer.
Once again, an obvious question with this claim that Moderna causes subclinical myocarditis in 3% of vaccinated adolescents is how could it? And another obvious question is how come in the clinical trials the side effect of chest pain was not more common in the group receiving the vaccine than in the group receiving placebo?
We should obviously have this sort of data from the manufacturers. It's disappointing that larger prospective studies were not done by the mRNA companies, Pfizer and Moderna, or governments, given the large number of young people getting vaccinated.
So you want more testing of vaccines? Seriously? The first version of Moderna vaccination was produced in the late 2019, a few weeks after the virus genome was sequenced. For an entire year, that vaccine was going through various tests, first on animals, then many rounds of tests on humans. Meanwhile, millions of people were dying from COVID. And you want more testing. In my opinion, lawmakers requiring all that testing of vaccines, especially the useless and cruel testing on animals, should be held responsible for the pandemic. More testing does not make us safer. More testing kills by delaying life-saving medications from being available to the general public. And this pandemic is, in my opinion, a story primarily about the governments requiring unnecessary testing of RNA vaccines before letting people be vaccinated with them. As if something like the Qatar vaccine incident is possible with an RNA vaccine. No, RNA vaccines are not attenuated virus vaccines that require a lot of safety tests. But the governments and you, Dr. Moran, are behaving like they are. And what's worse is that I hear a lot of people on the internet forums saying that Trump administration is the reason we got vaccines too soon. In my opinion, you have to be extremely delusional to think that. Trump administration delayed the general availability of RNA vaccines by months. If you think pharmaceutical companies should be required to test their vaccines even more before putting them on the market, then you have no right to call yourself a liberal, libertarian, anarchist, or anything like that, because you are about as authoritarian as a person can be.
I think the number one mistake that I think almost all countries during this pandemic is the fact that no one seems to talk about being healthy. Governments didn't talk about it, the media didn't talk about it, and people didn't talk about it. If you're healthy, you're so much less likely to develop disease, and if you do, you'll have a milder course. It's why I sign off all my videos with the phrase, get healthy and stay healthy. Not focusing on this during the pandemic was a major mistake. A lot less people would have ended up in the hospital or died if they had made efforts to improve their health and stay healthy. Many people have seen a significant decline in their health with this pandemic simply because they've not been eating properly, sleeping properly, exercising properly, managing their medical problems optimally if you have any, and trying to reduce stress. That's important as well.
I'm not at all convinced that people striving to stay healthy via exercise and healthy diet would reduce the number of people who died from COVID. Take a look at Sudan, a country where just about everybody has type 2 diabetes, yet it had very few COVID deaths. And when you think about it, it actually makes sense. In a country where everybody has type 2 diabetes, who would be those people with little or no symptoms who are spreading COVID? Epidemiology is complicated and often counterintuitive. Maybe we can have a fruitful discussion about the idea that perhaps we should not encourage young people to get vaccinated. But then you can use arguments such as that it is not a good idea to waste vaccines on low-risk people in developed countries, and there are countless high-risk people in developing countries that are not able to get vaccinated due to poverty. Or you can say that perhaps vaccinating young people puts the immunocompromised people at greater danger because young vaccinated people are behaving as if they cannot spread the virus. But saying that inserting RNA coding for the spike protein into our muscles somehow magically makes our cells produce some toxins which don't exist in the virus, and that those toxins cause myocarditis is obviously not a legitimate argument. That's contradicting basic biology. Anyway, that would be all for this video. Thank you for watching.